So the patient selection or the indication for transplant is something which is regularly covered by the societies, by the scientific societies. And the EBMT, for example, is writing every 2 years or 3 years an indication paper on this. So in Tandem, we discussed this, of course, and we actually identified patients which absolutely need transplants. So that means, for example, acute myeloid leukemia, which are high risk or intermediate risk, or patients which are relapsing with acute myeloid leukemia, they need a transplant. And this is going up to 75 years. So it's there is an age limit, of course, of 75 years. But until a few years ago, we had 50 years or 60 years. And so therefore, we have now methods on how to do transplants even in older age. And I am sure that this older age will also go up to 80 in the next years. So this is very important, age, but also comorbidities. So if the patient has other diseases, that was also always a problem. So this possibility has been now open to patients also with comorbidities by using reduced intensity conditioning, so non-myeloablative therapies. So also from this side, it's very important, and we are working, of course, to improve this, to reduce the graft-versus-host disease, and to decrease also the relapse incidence after transplant. And in the Tandem meeting, there was basic science, which was very, very good, was very new. So in the sense that we know, or there was a very early phase 1 study, or a discussion about phase 1 study, how we can reduce the graft-versus-host disease incidence in the gut without actually interfering with the graft-versus-tumor effect. And there was one of the best abstracts, which was looking at the receptor interactive protein kinase 1, which can be blocked without increasing the infection, but this in the mice now. So this will be now studied in humans, and we hope that this will be an important point. But of course, there were also many other things, like, for example, an antibody which was radioactive labeled, which was used in combination with stem cell transplantation with reduced intensity conditioning. And for patients with relapsed or refractory AML, and there was a stable overall survival, and this comparison study showed that this was better than the conventional therapy. So we have at the Tandem, we had really a very complete overview of what is new in basic science, but also in clinical science.